For many parents, watching their son struggle with anxiety, depression, or trauma is a silent crisis. The stakes are incredibly high. The suicide rate for teen boys is more than double that of teen girls. Often, standard weekly therapy sessions aren't enough to break the negative cycle. A 50-minute session can be undone by 7 days in a stressful school or social environment. So what does work? Ahead, we'll break down the environment, therapies, and proven results of residential care. The first key is changing the entire environment. Why is a 24/7 setting so fundamental to success? Residential treatment creates a safe, structured bubble, minimizing exposure to triggers. This predictability calms the nervous system, reducing a constant fight or flight state. With 24/7 supervision, staff can intervene the moment a crisis occurs, not days later. This forges a direct link between actions and outcomes in real time. This involves decompression, a total removal from daily stressors. But how does this help him prepare to go back to his world? The answer is coming up. Inside, they join a therapeutic community. For the first time, many boys realize they aren't alone, connecting with peers who get their struggle. This structured, supportive peer environment creates the foundation for deeper therapeutic work to start. That decompression isn't an escape, it's a strategic reset. By quieting the outside noise, it allows a boy to finally hear his own thoughts and focus on healing. Many programs are specifically for boys. This is intentional. It removes the social pressures of a co-ed setting, allowing them to be vulnerable without posturing. It actively dismantles the boys don't cry mentality. They learn that strength isn't suppressing emotion, but having the courage to express it. Therapists see that boys often mask fear with anger or sadness with isolation. The program creates enough safety for them to show what's really underneath. This allows for truly personalized plans, addressing co-occurring issues like substance use right alongside depression. In this safe space, they build a toolkit of new coping skills, naming emotions, managing anger, and communicating needs. So what does the therapy actually look like day to day? It's a blend of intensive evidence-based therapies, CBT for thought patterns, DBT for emotional regulation, and EMDR for trauma. But it's not just talk therapy. Experiential methods are key, especially for boys. Things like equine therapy or art provide a different way to process emotions. For example, learning to communicate with a 1,000-pound horse teaches patience, nonverbal cues, and self-regulation in a way a conversation cannot. And life doesn't stop. Accredited on-site schooling prevents them from falling behind. In fact, as their mental health improves, grades often follow. But is this all just about managing symptoms and teaching skills, or is something much deeper happening? The intensity of residential treatment allows therapists to go deeper, uncovering the root of the issue, the underlying trauma, grief, or low self-esteem. This is the difference between trimming weeds and pulling the root. Healing the core wound is what leads to profound recovery, not just temporary relief. But the teen is not an island. The family's involvement is non-negotiable for success. Active family participation in therapy and aftercare can reduce relapse rates by up to 75%. It's a vital piece of the puzzle. Let's connect the dots. That safe, all-boy environment we discussed, that's what makes it possible to do the terrifying work of confronting deep trauma. So, is it deeper than managing symptoms? Absolutely. It's a complete process of environmental reset, deep therapeutic work, and family reintegration. And the results speak for themselves. Studies show 50 to 60% of adolescents see significant improvement after residential treatment. Specifically, programs report seeing depression rates drop from 49% to 16%, and anxiety from 46% to just 18% post-treatment. This is life-changing. This level of progress is remarkable. But what happens when they go home? The work doesn't end at discharge. A strong, family-based aftercare plan is needed to integrate skills learned back into daily life. Remember where we started, with weekly therapy often falling short? Residential treatment offers the immersive intervention that complex cases require. For a teen boy struggling deeply, this is a powerful, evidence-based pathway to a healthy future. A professional consultation can determine if it's the right path.